head to your provider's office for a visit. Wouldn't it be great if they had all of the pertinent information they need for your visit, weeding out the unimportant stuff?
Did we hit the target? Did we actually improve clinical quality? Did we actually improve safety? Those are really our North Stars in terms of what we're trying to accomplish.
That's Dr. Jonathan Handler, Senior Fellow and Clinical Informaticist for OSF HealthCare, and I'm Shelley Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. OSF HealthCare, in conjunction with the University of Illinois Urbana-Champaign, has a program through its Jump Arches. It's an endowed fund that every year gives money to provide grants to develop new tools, techniques, and devices to enhance medical simulation and education, as well as for clinical use and treatment. Clinipane has received a Jump Arches grant to develop a companion application that is going to sit alongside the electronic health record. It will interact in real time to garner clinical content and context, receive formatted information relevant to that context from a clinical intelligence engine, and push insights to the clinician via the application's interface. That's a lot of stuff, and to help me decipher what all of that means and to explain it, joining me are Dr. Jonathan Handler, the Senior Fellow and Clinical Informaticist with OSF HealthCare, and Roopa Foulger, who is the Vice President of Digital Innovation Development. So I'm going to start with you, Dr. Handler. Explain to me what Clinipane is in layman's terms, because I gave a whole big mouthful at the beginning, and it has to be simpler than that.
Sure. There's a lot of information that the clinicians see when they're treating a patient. They go through the electronic health record to figure out what's going on, to see the current state of the patient, in addition to talking to the patient, of course, but they need to also need to review the patient's prior history, their lab tests, their diagnoses, everything that's happened to them in order to make an informed decision. And there's a lot of information to go through. And sometimes it can be hard to see and find everything and to recognize certain trends that are happening or all the different things that you would want to know in order to make the best decision about every patient. And so what Clinipane does is it connects with the electronic health record in real time, pulls out certain pieces of information, and if those pieces of information look what we call interesting, then we push that information to the clinician's eyeballs through the Clinipane app that's just sitting right next to the electronic health record. We've always had ways to show information to clinicians through the electronic health record. One has been to push these alerts that are interruptive. They pop up in the middle of your work and say, "Are you sure you want to do that? You know, that may not be a good idea." But because those interrupt the workflow and because they make, while you're trying to think, they get in the way, we've tried to limit those, or I shouldn't say we, but in general, healthcare has tried to limit those to the most important critical alerts. The other thing that kind of decision support is where the clinician has to go click around to go find it. And the problem is that during a busy visit where you don't have a lot of time with a patient, you may not have time to click around and find everything, especially when 90% of the time when you click on it, there's nothing to see. And then the third one is to push it to the clinician's eyeballs, but there's not a large size place where we can push virtually any formatted information to make it display in just the right way so that the clinicians are most likely to understand and take action on it. That piece has either been missing or seems to have had some features that we wished were there. So we developed Clinipane to make that happen so that when the clinician is sitting with the patient at the bedside, the information that they need to see is not only available in the electronic health record, but some of the most important information that we want to make sure they don't miss gets pushed to their eyeballs without interrupting their workflow.
So how do you determine exactly what is, as you put it, important? What are those important things that need to rise up there? Because, if I'm just in here for a primary care and my throat's bothering me a little bit, that's one thing. If I'm a cardiac patient, that's a whole other thing. So how do we determine what's important?
That's a big part of the work that we're doing in terms of configuring Clinipane is working with our clinicians to figure out what is important and to make sure that we can easily adjust the logic that's behind each one of the pieces of decision support to say if we didn't quite get it exactly right, how do we adjust it quickly? But for example, imagine that somebody has a lab test and it's not abnormal, so it doesn't flag as low or high, but it's been trending down consistently for the last several years, let's say. And at this rate, the next time they come visit us, if we don't do something, it will now be below normal and we'll be scrambling to catch up. So those are the kinds of things that we're looking to try and put in there and say, can we identify this before it gets to a point that we're scrambling in order to address this thing? There are other things like predictive models, predicting the likelihood that a patient will need a different drug than the one they're on, predicting the likelihood that the patient would do better with a different kind of therapy than the therapy they're currently getting. Those are the kinds of things that we would work together. We are working together with our clinical staff to say, which of these things do you wish would pop up in front of you if you knew it? Which of these things would you like us to push to your eyeballs and say, hey, this is something you might really want to see? So part of it is, what do they want to see? What are the things that they would act on? And part of it also is, of course, informed by the medical literature, the studies and the research out there in terms of what might be useful.
Rupa, I'll turn to you. Where does the innovation team fit into all of this? Boy, as I'm listening, you're trying to look into the crystal ball and figure out what you need, how you need, when you need it, aren't you?
Yeah, so I guess from an innovation standpoint, so Dr. Handler and I co-lead a clinical intelligence data lab that's through the JUMP endowment, and he and I co-build a lot of products along with the team. So this is something that Dr. Handler is very, very passionate about, and I've been observing the last decade too. We have so many tools that provide alerts or provide information to clinicians, but it's interruptive, right? So that's when we said, hey, let's do a research on this. So we applied actually for 2 research grants. One was, let's build a solution and see how it's going to fit. And then another one, which was important from an innovation standpoint, is the behavioral aspect of it and the human-centered design aspect of it. It's great to put a technology that might give all sorts of information, but if it's not intuitive and it's not helping the clinicians and not interruptive, it's not going to get used. So that was another research grant that we partnered with the University of Illinois Chicago, and kind of almost a year just did a research on what should that design look like. I think that was very important from an innovation standpoint, because we've always had predictive models, we've always had alerts and different solutions going out. But to Dr. Handler's point that he mentioned, how do you show the right thing, and how do you create a technology that can learn, right? And it's not hardwired to just operate in one way. So I think that was something from an innovation standpoint I personally felt was different, that we had to figure out and research and test it along the way.
Dr. Handler, does this, when it comes to quality and safety, does Clinipane help that? I would think, as I'm listening to this, that it would improve that, wouldn't it?
The whole goal and our aim and hope for Clinipane is that's exactly what it will do. That's the reason why we designed it, was to say, can we take what is already an outstanding clinical environment and make it even more outstanding, improving upon quality and safety in every way that we possibly can. And this was one way that we thought we might be able to continue to make a difference in healthcare in general. And so absolutely, that's our hope. And in fact, as we put it out into pilot, those are the kinds of things we're going to be looking at. That's what we were aiming for. Did we hit the target? Did we actually improve clinical quality? Did we actually improve safety? Those are really our North Stars in terms of what we're trying to accomplish.
So what have been the biggest challenges getting to this point? I mean, this process has been going for a while. I hear Roopa say about a year ago on the one grant that you applied for. So that's not a short time period. I see smiles on both of your faces. So there've probably been some challenges along the way. Tell me about them.
We faced a number of challenges. It all throughout, pretty much everything in terms of whether the project was even feasible in the first place. And then once we decided it might be feasible, how do we interact with the electronic health record? What's a way to interact with that electronic health record that would be the least disruptive to the clinician's workflow? How do we make sure that every single thing that we do with relation to Clinipane is absolutely as secure as we could possibly make it? How do we have Clinipane live in different environments on different kinds of desktop, virtual desktops, physical desktops? Every single one of these things proved to be much more challenging than I think we thought it would at the beginning of the project. And there was a lot of learning on our part in terms of some of the underlying technologies that we had to use. And part of that learning, of course, just took a little bit of time and a little bit of hiccups and bumps down the road. But happily, we got through almost all of it so far. So it's exciting to see where we take it.
Roopa, from your perspective, the biggest challenges?
I think the biggest challenges one was the technology aspect of it. And then the next is like just fine tuning the interface, the look and feel, so that it's less disruptive for the clinicians. And we are still fine tuning that. I think breaking down the technology aspect of it, as Dr. Handler covered, the security part, right? Because it's going through so many different communication pathways, and we needed to make sure it was really secure. So that took a long time, making sure there were less failure points along the way, and it was as secure as possible. And also a quality, security from a quality and safety standpoint, we needed to make sure we are showing the right information for the right patient that the clinician was looking at. So it's not just security, so that from a cybersecurity standpoint, but also from a quality and safety standpoint. And then, as I said, it's the how do you back and forth on the fit, on how it looked within the EHR, because there's one thing when you do research and when you actually take it to an environment that we're actually using, right? You go through different challenges. So the look and feel and revising that and ensuring it fit well within the workflow, something which we're still working on and will learn more through the pilot.
So where are we at now? Are we getting to the pilot? We've started the pilot, or walk me through where we're at now and what lies ahead in the coming months.
So we are almost done with our development and our testing. I would say more fine-tuning within our environment. And we hope to take it to pilot in October with a select few of physicians in a certain region and learn through that. So we are hoping to go in October. There was some delays, as I said, because we wanted to ensure that this was fail-proof and very secure, and that's part of the reason why it's taken a year as well.
Well, you want that. Everybody
Right.
wants that. I mean, absolutely, no questions asked. What will this mean for patients, Dr. Handler, when it gets there and looking in the crystal ball down the road? I know sometimes that's hard to do, but ultimately, what could this mean for patients when it's fully implemented?
Well, first and foremost, if it allows us to provide even better care than we already do, that would be great. Secondly, this may be a way to help engage patients. For example, if we can surface data that they would otherwise not be able to see and show it in ways that they otherwise would not be able to see it, and if those things help engage the patient in their own process of care and help them to help us to stay healthy, help them stay healthy and to get healthier, that could be a really significant way to help patients that might have a little bit of newness to it that could be exciting. So I think there's probably a lot more to that as well. We don't even know what we don't know. The beautiful thing about this is we built it as a platform so that it has the potential to do things we haven't even really envisioned yet. And so the ways that we work with patients and engage with patients on the clinical side, we expect those to evolve over the years, and we're hoping this will be another tool that takes that even further.
Yeah, I know you're big on AI innovation and the possibilities that are out there. Is this the next in a long string of things that you could see really continuing to have a great impact on healthcare?
I'm hoping so. One of the questions that came to my mind as AI was coming into the forefront is, and it's been coming into the forefront for, it seems like a very long time, but wow, is it really now, taking root, is where are we going to surface all this information? And how are we best going to display this? And there may be alternative paths to show what AI can give us that we don't already. There may be alternative ways to show this information that we don't have today. And Clinipane may be kind of a canvas to allow us to paint new ways of showing this information, and explore what those new ways might be and what's most effective. The other thing is really just to kind of loop back around your question about how do we make sure this stuff is relevant. One of the things that we designed as part of our design grant was to make sure that there would be a feedback loop for every piece of decision support. And so that feedback loop can actually come back to us, and that gives us the data that we would need if we wanted to put artificial intelligence in front of it and say, what is the likelihood that the clinician will benefit from this clinical decision support and that they will take action on it? We will hopefully have the data that we need to train those AI models so that hopefully Clinipane can be a continually learning system. So that'll be hopefully another way that we can be sure, or more sure, that when we show some piece of information to a clinician, that it might be useful to them.
Okay, before I let the two of you get out of here, I'll ask you the final question, and I'll start with Roopa. What excites you most about where this project has been, where it's at now, and what lies ahead?
I think what I'm excited about is how we approach the whole platform, not only from a design thinking standpoint, but also the technology behind it. It's very modular. So it's very scalable, and we can, expand and grow. And as you stated, AI is kind of at the forefront now, and you need a system that can not only scale but continuously improve and learn along the way. And that's the part that I'm excited. And the thing about decision support or AI, not all of us will be able to build everything, but how do we have a platform that can bring the best of breed? So we could partner with the startup, partner with some of our EHR vendors, but give a very dedicated solution that is, that our clinicians can consistently use, because we're creatures of habit, right? And you want to see some of these ambient analytics consistently in one environment. Doesn't matter where the AI is coming from. So that is a part that I'm excited about, where we've intentionally, and I give kudos to Dr. Handler for that, kind of pushing us to make sure this can iterate, evolve, and continuously improve, because that's one of the mantras in innovation, right? You continuously learn and innovate along the way.
And Dr. Handler, what excites you most on this whole project?
I don't know that I could say it better than what Roopa said, but what I would add to that is this is an opportunity to have all sorts of folks in our community at OSF engage in creating new forms of clinical decision support that can best serve them at the point of care. And so it's just another tool in the toolbox. And now it's exciting to see what will people do with it. And all the ideas don't have to come from us. That's the beautiful part. We've got a lot of really smart, really capable, really talented, passionate, dedicated people who really, really, really want to see the best in healthcare. And we're giving them another tool, and I'm excited to see what they can do with it.
Dr. Jonathan Handler, Roopa Foulger, thank you so much for being with us. It's fascinating. We'll look forward to seeing where it develops and where it goes from here, and we'll probably check back in with you down the road a ways just to see. And thank you for being with us as well. A reminder, you can check out all of our podcasts online. Just go to osfhealthcare.org/accelerated.